Hello friends, welcome back to Complete Medical Coding. Let's discuss few more questions today. So if you are new to the channel, please support me by subscribing to the channel and please press the bell icon to receive all the notifications. Okay, so let's learn the mock questions today. First question. A 76-year-old female had a recent mammographic and ultrasound abnormality in the 6 o'clock position of the left breast. She underwent 4 biopsies which showed the presence of a papilloma. The plan now is for needle localization with excision to rule out occult malignancy. After undergoing preoperative needle localization with hook wire needle injection with methylene blue, the patient was brought to the operating room and was placed on the operating room table in the supine position where she underwent laryngeal mask airway LMA. Okay, the short form is LMA, laryngeal mask airway anesthesia. The left breast was prepped and draped in a sterile fashion. A radial incision was then made in the 6 o'clock position of the left breast, corresponding to the tip of the needle localizing wire. Using blunt and sharp dissection, we performed a generous excision around the needle localizing wire, including all of the methylene blue stained tissues. The specimen was then submitted for radiological confirmation, followed by permanent section pathology. Once hemostasis was assured, digital palpation of the depths of the wound failed to reveal any other palpable abnormalities. At this point, the wound was closed in 2 layers with 3-0 vicryl and 5-0 monocryl. Steri strips were applied. Local anesthetic was infiltrated for postoperative analgesia. What CPT and ICD-10 CM code describe this procedure? So here, excision. Which procedure is being done here? Excision. Okay. So here the patient had done mammography and ultrasound, which shows abnormality of left breast. So she had undergone biopsy and it shows papilloma. So papilloma is the diagnosis. So the plan now is for needle localization with excision. Yes, so excision is the procedure carried out. Okay. So let's look into the options one by one. What is the first option? Let's look into the ICD codes first. Okay, what is N63? N63 represents unspecified lump in the breast. The ICD code N63, unspecified lump in the breast. It just mentioned unspecified lump in the breast. What is the next ICD code? C50.919. C50.919 means it represents malignant neoplasm of unspecified site of unspecified female breast. This is not unspecified, but this is left breast. Okay. What is R92.8? Other abnormal and inconclusive findings on diagnostic imaging of breast. This is, so what is option D? D24.2. D24.2 represents benign neoplasm of left breast. Okay. So that's what we need. The diagnosis here is malignancy, presence of papilloma. Okay. And then the plan is for local needle localization with excision to rule out malignancy. So malignancy is the to rule out malignancy, but this is a neoplasm, right? So we cannot code it as malignant neoplasm because it is to rule out. The excision is being carried out to rule out if, the presence of malignancy. But we can code, since this is a neoplasm, we can code benign neoplasm of left breast, which is the ICD code D24.2. Okay. So that will be our diagnosis code. And what is the CPT code mentioned in option D? 19125. Just look that also if it is right or wrong. Okay. What is CPT code 19125? It is the excision procedure of the breast. Okay. Excision of breast lesion identified by preoperative placement of radiological marker. Yes, there is a radiological marker mentioned here, right? See, the specimen was then submitted for radiological confirmation followed by permanent section pathology. It is then sent for radiological confirmation by permanent section pathology, and then yeah, that's it. And there was no abnormalities present. So this is the CPT code 19125, which means excision of breast. Here the procedure carried out is excision, right? Excision of left breast. So this is the CPT code, excision of breast lesion. Okay, identified by the preoperative placement of radiological. And then the diagnosis is D24.2, which represents benign neoplasm of left breast. So our answer is option D, 19125, and the diagnosis D24.2. Let's move to the second question. A 79-year-old male with symptomatic bradycardia and syncope is taken to the operating suite where an insertion of a DDD pacemaker will be performed. A left subclavian venipuncture was carried out. A guide wire was passed through the needle and the needle was withdrawn. A second subclavian venipuncture was performed. A second guide wire was passed and the second needle was withdrawn. An oblique incision in the deltopectoral area incorporating the wire exit sites. A subcutaneous pocket was created with the cautery on the pectoralis fascia. An introducer dilator was passed over the first wire and the wire and dilator were withdrawn. A ventricular lead was passed through the introducer and the introducer was broken away in the routine fashion. A second introducer dilator was passed over the second guide wire and the wire and dilator were withdrawn. An atrial lead was passed through the introducer and the introducer was broken away in the routine fashion. Each of the leads were sutured down to the chest wall with 220 silk sutures each, connected the leads to the generator, curled the leads and the generator was placed in the pocket. We assured hemostasis. We assured good position with the fluoroscopy. What code should be used for this procedure? So here, see, while looking into the question, you may find it difficult because the question is big, but just look into the options. Just one CPT code, right? Here in the question, we have to report only the CPT code, only the procedure, not the diagnosis. So first, don't be scared seeing the question. It will be just an explanation of the procedure. So initially, it's meant what procedure is being done here. We have to identify what procedure is being done in the question and what diagnosis is mentioned, is confirmed in the question. Anyway, here we doesn't require diagnosis, only the CPT code that we need to mark it. Okay. So what procedure is being done here? It's clearly mentioned in the first sentence. Pacemaker, insertion of a DDD pacemaker. What is a DDD pacemaker? DDD pacemaker represents a dual chamber pacemaker. Dual chamber pacemaker means the pacemaker that consists of two leads. Okay, one for right atrium and the one in the right ventricle. So that's why they have mentioned, because two leads pacemaker is being inserted. That's why they have mentioned DDD pacemaker. Okay, that's why in the following sentences it's mentioned about second, everything has been done twice. See, second venipuncture performed, second guide wire was passed, second needle was withdrawn. Everything mentioned 2 times here. See, atrial lead was passed through introducer. Everything is mentioned. So the following sentences just represent how the procedure is being done. Okay, how the procedure is being carried out. So anyway, let's move to the options one by one. What is the first option? 33208, first CPT code. 33208. Just go to 33208. What does it mean? It represents insertion of New or replacement of permanent pacemaker with transvenous electrodes, atrial and ventricular. Yes, we need this one itself, right? Because the pacemaker with two leads, one is for right atrium and one is for right ventricle. So atrium and ventricle, atrial and ventricular. So this is the correct answer that we need, correct option, the correct CPT code that we need. But in order to identify that, you have to know what is a DDD pacemaker, right? That's why it's mentioned in the question, DDD pacemaker. So always remember, DDD pacemaker means dual chamber pacemaker, which means the pacemaker that consists of two leads, one for the right atrium and one for the right ventricle. Okay, don't forget that. That's important here. So 33208 is the correct option. Still, let's look into the other CPT code as well. What is in option B? 33212. 33212. 33212 represents pacemaker. What is the description of 33212? Insertion of pacemaker pulse generator. Only this is not only pulse generator, right? Now 33226, option C. What is 33226 represents? Repositioning of previously implanted cardiac venous system. This is not replacement, insertion, right? It's clearly mentioned in the first sentence that insertion of pacemaker. Now, the last option 33235. What is 33235? Represents removal of transvenous pacemaker electrode dual lead system. This is not removal, this is insertion. So we already got the answer as option A, which is CPT code 33208. Insertion of a dual lead pacemaker for atrium and ventricular. Okay. Now let's move to the third question. An 80-year-old patient is returning to the gynecologist's office for pessary cleaning. Patient offers no complaints. Pessary cleaning means it's an instrument inserted. Okay. The nurse removes and cleans the pessary. Vagina is swabbed with betadine and pessary replaced. For follow-up in 4 months. What CPT and ICD-10 should be used for this service? Pessary means it's an instrument that is usually fitted for old age people for the collection of urine, like catheter. Okay. So this is a simple question, right? Let's look into the diagnosis first. What is the diagnosis? What is the diagnosis that is used for this procedure? The presence of or fitting of this pessary. Okay, that is a diagnosis. Fitting or adjusting or cleaning, whatever it is. Anyway, let's look into the ICD codes first. The first option, Z97.5. What is Z97.5? Represents presence of intrauterine contraceptive device. This is not a contraceptive device. Okay. Don't think that it's a contraceptive device. Now, what is in option B? Z44.8. Z44.8 means fitting and adjustment of other external prosthetic devices. This is an external prosthetic device. Okay, this is not an IUD, this is not a contraceptive device. Anyway, you will come to know because this is a 80-year-old female. So Z44.8 means fitting and adjustment of external prosthetic device. Still, let's look into the other options, other ICD codes. T83.69. What is T83.69XA? We know that T will not come in this question, right? Because usually S and T codes represents injury and poisoning. So what is T83.69? Infection and inflammatory reaction due to a prosthetic device, implant and graft in the genital tract. If it is mentioned anything in the question about infection, then we can use this code. But there is nothing mentioned about infection. Okay. So T code will not be the answer. What is the last one? Z46.89. encountered for fitting and adjustment of other specified devices. Now we have a specified device as prosthetic device. So our correct ICD code is option B, Z44.8. Okay. So we already got the answer as option B, Z44.8. Still, what is the CPT code mentioned there? 99211, because this is an office visit, right? Office or other outpatient visit for the evaluation and management of established patient that may not require presence of a physician. Yes, so that is correct. So that CPT code is correct and the ICD code is Z44.8. So our answer is option B. Okay. Now let's move to the fourth question. A 20-day-old infant was seen in the ER by the neonatologist admitting the baby to NICU for cyanosis and rapid breathing. The neonatologist performed intubation, ventilation management and a complete echocardiogram in the NICU and provided a report for the echocardiography which did indicate congenital heart disease. Select the correct codes for the physician service. So here we need to code only the CPT codes. Okay, we have to code only the CPT codes here. So what procedure is being done here? The patient is being admitted to NICU. It means critical care, right? NICU. If the patient is admitted to NICU, it means you have to code the critical care code. And then what procedure is being done? Echocardiogram. Completed echocardiogram is being done, which indicate congenital heart disease. So that is the diagnosis. Congenital heart disease. Anyway, we don't have to code diagnosis here. They are asking only the CPT code. So let's move to the option. What is the first code? CPT 99468. What is 99468 represents? 99468 is the neonatal critical care. Initial day of critical care for E&M of a critically ill neonate, 28 days of age or less. Yes, this is 20 days. So 28 days or less. So this is the correct neonatal code. If you check the other code, it will not be the neonatal critical care. If you want, we can just look into the other option, other CPT codes also for the neonatal. What is 99471? 99471 inpatient initial pediatric critical care per day. This is not per day, this is just initial neonatal care, which we already got. First one. What is 99460? 99460 represents initial hospital or birthing center care. This is not birthing center, so leave that. And 99291 represents the E&M code. So, as discussed, we already got the neonatal critical care CPT code as 99468 with modifier 25. Modifier 25 is what does modifier 25 represents? Modifier 25 is significant, separately identifiable E&M service by the same physician or other qualified professional on the same day of procedure or other service. Yeah, same physician is doing the procedure, right? Intubation, ventilation management, echocardiogram, everything. That's why it's being reported with the modifier 25. And what is 93303? It's the echocardiography. 93303. The exact description is transthoracic echocardiography for congenital cardiac anomalies complete. Yes, this represents after the echocardiography, the physician identified it as congenital heart disease. So 9330 is the CPT code along with modifier 26. Modifier 26 represents professional component because the physician itself is had done the echocardiography procedure. So that is a professional component. So we got the answer as option A, 99468 with modifier 25 and 93303 with modifier 26. Now let's move to one more question, fifth question. A patient is having knee replacement surgery. The surgeon requests that in addition to the general anesthesia, GA means general anesthesia for the procedure, the anesthesiologist also insert a lumbar epidural for post-operative pain management. The anesthesiologist performs post-operative management for 2 post-operative days. Select the correct codes for this service. So here also we have to code only the procedure code. What is the procedure done here? The diagnosis done is knee replacement surgery, but we don't have to code the diagnosis. We have to code for the procedure. What procedure is being done? Insertion of lumbar epidural has been done by the anesthesiologist for 2 post-operative days. Okay, so let's check the options one by one. What is the first CPT code? 62326. Here GA means general anesthesia has been given. The surgeon requests that in addition to the general anesthesia. So it means general anesthesia is being given, and then along with general anesthesia, the anesthesiologist performs post-operative management, lumbar epidural, insertion of lumbar epidural for 2 post-operative days. So these 2 codes we have to mention here. Okay. So what is 62326? 62326 represents injection, drainage or aspiration, spinal cord into the spinal cord. That means there is a anesthesia, the injection given, right? The anesthesia code we will look later. What is the next CPT code in option B? 01996. 01996 represents daily hospital management of epidural or subarachnoid continuous drug administration times 2. So it means for 2 post-operative days. So we have to code it twice. Epidural is being given, right? Epidural for 2 post-operative days. Lumbar epidural. So this is the code for lumbar epidural 01996. Daily hospital management. This is daily, per day. So if the physician is being done for 2 post-operative days, it means we have to code it twice. That also, that code also we have to code. Now coming on to option C. Both these codes 62326 and 01996 times 2. These both codes we need, right? What is 01402 represents? The anesthesia code 01402. 01402 is the total knee arthroplasty anesthesia for open or surgical arthroscopic procedure. Yeah, this is anesthesia for the knee, right? On knee joint, total knee arthroplasty. Yeah, this is total knee replacement. So total knee arthroplasty. So we have to code the anesthesia code 01402. What is 400? Not otherwise specified. No, this is total knee arthroplasty. So we have to code the anesthesia as 01402 along with modifier AA. What is modifier AA? The anesthesia is being given personally performed by the anesthesiologist. Anesthesia services personally performed by the anesthesiologist. That is AA means. Okay. So, and in option D, only 62326 is mentioned. We have to code for the anesthesia code, the general anesthesia injection which is given. That is code 62326, and then the epidural, lumbar epidural insertion for 2 days. So that is what 01996. So the correct answer is option C, 01402 with modifier AA, 62326 and 01996 times 2. Okay. If you have any inquiries, if you have any doubts or clarifications, you can mark in the comments. I'll explain it to you again. Okay. So friends, these are few more questions from the CPC examination. I know few questions are a little bit confused. So if you have any comments, if you have any doubts or queries, you can mark it in the comments and I'll be explaining to you again. So stay tuned friends for more videos. If you like the video, please like and share. Please share it to your friends. And if you are new to the channel, please subscribe and support me. And don't forget to press the bell button so that you will be getting all the videos notifications. Okay. So thank you so much friends and stay tuned. See you in the next episode. Bye.